Cardiac arrest. Cardiac arrest means the heart is no longer moving blood through the body. When blood circulation stops, the brain shuts down, including its respiratory centre. So, when the heart stops, so does breathing, usually within a minute or less. Causes of cardiac arrest include heart's electrical system malfunctions, electrocution, a drug overdose, losing a large amount of blood, and suffocation. Most cardiac arrests occur when a diseased heart's electrical system malfunctions. This is known as sudden cardiac arrest, or SCA. There is often little or no warning. A victim will lose consciousness, have absent or abnormal breathing, and no blood circulation. Sudden cardiac arrest is the leading cause of death. Sudden cardiac arrest. Across the UK each year, around 30,000 sudden cardiac arrests occur outside of hospitals. The chance of survival is low at around 10%. While this means only about 1 in 10 people survive out of hospital cardiac arrests, this is almost twice the survival rate of a decade ago. If you follow the chain of survival and use a defibrillator quickly, the survival rate dramatically improves, rising to around 1 in 2 patients recovering. A notable public example is the footballer Christian Eriksen, who received CPR and defibrillation very quickly after collapsing on pitch with a cardiac arrest during the Euros in 2021. The Eriksen incident reignited calls for the government to make defibrillators a legal requirement in all public places, including schools, sport facilities, and other public buildings. This is something fellow footballer Fabrice Muamba has been calling for since he suffered a cardiac arrest during a match in 2012. Both footballers received effective CPR, which keeps blood flowing around the body, providing vital organs with oxygen. However, in both cases, it was the use of a defibrillator to provide an electric shock which restarted their hearts, restoring a normal blood flow. In the case of cardiac arrest, CPR alone is unlikely to restart the heart and restore it to a normal rhythm. In most cases, defibrillation is required. Now, let's look at the chain of survival. The chain of survival. Following a sudden cardiac arrest, the chain of survival refers to the actions that a first aider will take in order to maximise the chance of the patient's survival. A person's heart will stop beating without warning when they suffer sudden cardiac arrest. They will collapse, lose consciousness, and look extremely pale. The chain of survival is 1. Recognise sudden cardiac arrest. The person will be unconscious, unresponsive, and not breathing normally. 2. Call the emergency services immediately. 3. While you wait for paramedics, give CPR with emphasis on chest compressions. 4. Use a defibrillator, also known as an AED or pad, to restart the heart. 5. Ambulance arrives. 6. Hospital care. Every second counts. Steps 1 to 4 do not require trained medical professionals. Anyone could save a life by understanding and following the chain of survival. Step 4 is to use a defibrillator or AED. When used within the first 3 to 5 minutes of a person suffering a sudden cardiac arrest, an AED can dramatically increase a victim's chance of survival from less than 5% to as much as 70%. In many locations, an ambulance is unlikely to arrive within a 5-minute time window. So, do you know the location of your nearest AED?